its citizens. Mr. President, the Senate is aware of the advent of an unknown disease in Wuhan, China in December 2019. The disease was later diagnosed and named by the World Health Organization in January 2020 as coronavirus infection disease 2019, shortly known as COVID-19. The Senate is aware that Nigeria experienced its first index case of COVID-19 on the 28th day of February 2020 with the diagnosis of an Italian citizen who was a consultant to Lavat Company in Ihekweazu, Ogun State. The Senate notes that between 28 February 2020 and 2nd December 2020, 67,960 cases of COVID-19 have been reported in Nigeria, and sadly, 1,177 persons diagnosed with the condition have died, while 63,839 persons have been discharged. The Senate further notes that to coordinate the national response to the pandemic, the President of Nigeria set up a presidential task force in March 2020. That is the PTF. The PTF has been coordinating the strategies and activities to address the challenges emanating from the COVID-19. The Senate is concerned on the devastating effects of COVID-19 on the social and economic lives of Nigerians, including precipitating the economy to go into a recession. The Senate notes that the key measures being implemented now for the COVID-19 are the promotion of hand washing, wearing of face masks, and social distancing. The Senate is, however, worried that the level of compliance with these measures has been diminishing. The Senate is further worried that the level of testing, detection, and isolation of confirmed cases have also been reducing in the country. The Senate is aware that some countries have approved vaccines for COVID-19 and are administering the vaccines to their citizens. And the Senate is aware that many other countries have completed plans on the procurement, distribution, and administration of the vaccines to their citizens. However, the Senate is extremely worried that Nigeria has not produced a plan for the procurement, distribution, and administration of the vaccines to Nigerians. And the Senate is concerned that the only plan on COVID-19 vaccine for Nigeria is the pledge by the Global Alliance for Vaccine Initiative, known as Gavi, an international partner on vaccine, to support 20% of the country's vaccine requirement. This support will cover only the cost of the vaccines without taking care of the logistics requirement for distribution and administration. The Senate is concerned that despite the change in the epidemiological trends of the disease, the financial plan developed by the country and the World Bank in April 2020 to fund the response to the pandemic is still being implemented without taking due cognizance to these changes by reallocating the fund to procure vaccines. The Senate is worried that the failure to administer vaccines to Nigeria will result in the country not being able to control the COVID-19 infection, and a possible ban on traveling by Nigerians may be instituted by countries around the world. The Senate is therefore concerned that the consequence of non-administration of the vaccines to Nigeria will include worsening social and economic situation. Therefore, the Senate is ought to resolve, 1, to direct its Committee on Health, Secondary and Tertiary, and Primary Health Care to invite the Federal Ministry of Health, the Presidential Task Force of COVID-19, the National Primary Health Care Development Agency, the National Agency for Food, Drugs Administration and Control, the National Center for Disease Control, the Federal Ministry of Finance, and any other relevant government agency to present to it detailed plans, approval protocol, funding, procurement, administration, and monitoring of COVID-19 vaccine in Nigeria. 2, to urge the President to provide adequate funds for the procurement and administration of COVID-19 vaccines to Nigeria. And finally, to direct the committees to report back to the Senate in 2 weeks. I so move, Mr. President.
The Deputy Senate Leader.
We have addressed issues like this without plan, adequate plan. We have had instances when vaccines were imported into this country, but because we are not prepared to even store them adequately, those vaccines go bad and they cannot be used. So it is very important that we have plan to receive even whatever amount of vaccine we have, that we can store it properly and we can use it properly. I want to thank Mr. President for setting up the PTF, which has adequately tackled and addressed the issue of COVID-19. In fact, the speculation was that within 2 weeks of this pandemic, people will be dying and be seen by the roadside in Nigeria. But that has not happened, either because of our environment, but definitely because it was adequately addressed by Mr. President. Now, there are some rumors going around about the different types of candidates of vaccine. And I think the one that has received approval by the UK is the one produced by Pfizer, which have been known to be effective in about 95% cases. There are other candidates, but there has been controversy. What Pfizer is producing is the mRNA vaccine, which also Moderna is producing. This is quite different from what is normally done. In the traditional sense, the conventional sense, what is used is an attenuated form of the bacteria or the virus, which then stimulates the body to produce antibodies. It is not completely safe. But in this case, what is being done is the messenger RNA that has been coded to stimulate the body to produce antibodies. It's a more robust method, safer method than the conventional ones. Now, the idea that has been circulated that this thing has the tendency to change our genetic constitution is wrong. It has no way of intervening with the DNA. The DNA is there. This is a coded messenger RNA. It's always in our body. Our intelligence, memories is stored in form of messenger RNA. What we look like today is our phenotypic presentation and is decided by our gene, which is DNA. The DNA cannot do anything without messenger RNA. So we have messenger RNA in our body every time. So the issue of introducing messenger RNA to cause genetic change, like GMO, is completely wrong. So in the plan, we must decide which one are we taking. But I think what is being accepted globally is the messenger RNA produced by Moderna and Pfizer. We must prepare for in-transit transportation because those who produce these vaccines have specified the environment, the temperature, how it has to be contained, even to transfer it from the airport to where it's going to be stored. So the in-transit transportation is very important. In-situ transportation is very important. And because of our erratic power supply, we must ensure that whatever storage we are going to have 24 hours power supply. Then also, how do we get it to the people? What are the priorities? Who gets it first? Is it the senators or the ministers? I mean, I'm just saying this. We must have adequate plan. So we will not be discouraged by the rumor going on, which has some religious connotation, that the messenger RNA is being introduced, there's a chip inside. There's no chip inside. Messenger RNA is part of us. It's been used before. When you want to get insulin, insulin is obtained from pigs and sheep. It's very expensive. But today, messenger RNA coded for insulin is introduced into bacteria, and the bacteria produce insulin in large quantity. It makes it cheaper, and it makes it accessible to people. So I want to thank the chairman of the Health Committee for bringing it up, because the earlier we start to prepare to receive this vaccine, to work out how we are going to distribute it, I think it will be in the interest of this nation. So, Mr. President, thank you for giving this opportunity. Thank you, my decision court.
Thank you very much. We'll go to prayer 1, to direct its Committee on Health and Primary Health Care to invite the Federal Ministry of Health, the Presidential Task Force on COVID-19, the National Primary Healthcare Development Agency, the National Agency for Food and Drugs Control, NCDC, Federal Ministry of Finance, and any other relevant government agency that is to present to it detailed plan approval, protocol, funding, procurement, administration, and monitoring of COVID-19 vaccine in Nigeria. Those in favor of prior 1 say aye. Those against say nay. The ayes have it. Prior 2, urge the President to provide adequate funds for the procurement and administration of COVID-19 vaccines to Nigerians. I don't think we should urge the President, because the President needs the approval of the National Assembly. So maybe the government. Is that okay, Chairman? Because when you say the President, it doesn't mean that we are not supposed to approve it. So do you mind if you, government? Okay. Okay. Prior to urge the government to provide adequate funds for the procurement and administration of COVID-19 vaccines to Nigerians. Those in favor of this prayer say aye. Those against say nay. The ayes have it. And prior 3, direct the committees to report back to the Senate in 2 weeks. Which committees? Because he didn't mention. We should mention the committee. Health and the deputy leader. I know that some of us wanted to make some contributions on this, but let me emphasize that if we are not able to capture this, the necessary fund, the required funds for the procurement of the vaccines, we should start thinking of doing that. If we are not able to do it in the 2021 appropriation, then we have to be prepared for a supplementary appropriation, because this is a matter of life and death. So we have to be conscious of this. Secondly, the procurement process itself. The committees of the National Assembly must ensure that our country goes for the best. No cutting corners, because we take the wrong vaccines, we may survive COVID, but not the vaccines, God forbid. So we must ensure that whatever the government decides, our health authorities decide or recommend for us as a country is what is the best for our people. And of course, the logistical problems of distribution. This is a challenge even in the developed countries, because you may have the vaccines, but in the distribution you could easily invalidate whatever is there to protect us. So we need to be extremely careful and monitor. Our committees on health, both in the House and the Senate, will have a lot of work to do on this. And of course, the administration, whatever the specifications are, we must stick to it. Otherwise, even if the vaccine is okay, if we don't administer as is required, we may not achieve the efficacy that is expected. And also the other important thing is, who takes first? Our health personnel, who are daily exposing their lives into jeopardy. Some of them are even dying. And we should take cue from other countries. I think this should not be a big man thing. Let's start from the right set of people, those who are in the on the battle line, so to speak, front line. We start with them, and then of course we should have a strategy on how everyone in the country gets vaccinated. Thank you very much, Chairman. Leader of the Senate.